Hello, everyone. It's Monday, October the 4th. We've lost an additional 47 West Virginians. It's hard to sit here and say, well, things are looking better, but you'll see from our numbers, I think that we have been in the eye of the storm. I do think that things are beginning to look a little better, but for crying out loud, for these people, these families, these loved ones and everything, things are really tough right now. Don't let them become a number. The 3,723rd death is an 88-year-old female from Lincoln County. The 3,724th death is an 80-year-old male from Mineral County. The 3,725th death is a 73-year-old female from Lewis County. Now we get used, don't we? We get really used to hearing 88, 80, 73 years old. Now just get this. The 3,726th death in West Virginia is a 21-year-old male from Braxton County. This thing is reaching across all of us, and we better really know that. The 3,727th death, a 59-year-old female from Pleasants County. The 3,728th death, a 70-year-old male from Kanawha County. The 3,729th death, an 81-year-old male from Randolph County. The 3,730th death, a 77-year-old female from Harrison County. The 3,731st death is a 67-year-old male from Clay County. The 3,732nd death is an 87-year-old male from Greenbrier County. The 3,733rd death. It even gets worse, doesn't it? A 20-year-old male from Berkeley County. The 3,734th death, a 63-year-old male from Kanawha County. The 3,735th death, a 72-year-old female from Putnam County. The 3,736th death, a 40-year-old female from Lewis County. The 3,737th death, a 71-year-old female from Greenbrier County. The 3,738th death, a 58-year-old male from Randolph County. The 3,739th death, a 55-year-old female from Ohio County. The 3,740th death, a 70-year-old male from Berkeley County. The 3,741st death, a 79-year-old female from Jefferson County. The 3,742nd death, a 74-year-old female from Preston County. The 3,743rd death in this state is a 104-year-old female from Cabell County. I hate like crazy that we've lost her to this tremendous, terrible disease and terrible pandemic, but we salute her wisdom and we thank her. The 3,744th death, a 61-year-old female from Lewis County. The 3,745th death, a 71-year-old male from Nicholas County. The 3,746th death, a 79-year-old female from Wayne County. The 3,747th death is an 86-year-old male from Harrison County. The 3,748th death, a 35-year-old male from Harrison County. The 3,749th death, a 51-year-old female from Harrison County. The 3,750th death, a 74-year-old male from Berkeley County. The 3,751st death, a 69-year-old female from Wood County. The 3,752nd death, a 92-year-old male from Raleigh County. The 3,753rd death, a 91-year-old male from Raleigh County. The 3,754th death, an 81-year-old male from Mineral County. The 3,755th death, a 79-year-old female from Lincoln County. The 3,756th death, a 60-year-old male from Barber County. The 3,757th death, an 85-year-old male from Wood County. The 3,758th death is a 53-year-old female from Hancock County. The 3,759th death, a 99-year-old female from Hancock County. Let me back up just a second. The 3,758th death is a 53-year-old female from Wayne County. I don't know if I mispronounced that or said another word. The 3,760th death is a 72-year-old female from Wood County. The 3,761st death is an 80-year-old male from Cabell County. The 3,762nd death is a 72-year-old female from Mercer County. The 3,763rd death is a 76-year-old female from Roane County. The 3,764th death is a 64-year-old male from Fayette County. The 3,765th death is an 82-year-old female from Raleigh County. The 3,766th death is a 67-year-old female from Logan County. The 3,767th death is a 64-year-old female from Logan County. The 3,768th death is a 64-year-old female from Logan County. The 3,769th death is a 69-year-old male from Logan County. I want to just check one thing and everything, but we've got the 3,767th death, a 64-year-old female from Logan County, and the 3,768th death is also a 64-year-old female from Logan County. You know, is that correct? Okay. You know, I just said a second ago when I read, you know, that the 3,743rd death was a 104-year-old female from Cabell County. And I said, we salute and we thank her for all of her wisdom and all that she gave. We do exactly the same thing for all these folks. All these folks have given us so much. In this, we lost a 20-year-old, a 21-year-old. Tragic beyond all comprehension. But really and truly, whether it's the 20-year-old or the 104-year-old, we've lost wisdom, we've lost absolute opportunity, we've lost love, we've lost so much. So absolutely, please, please keep these people in your prayers. Our active cases continue to drop, you know, and, you know, our active cases, okay, they're telling me we've got to revise our cases here in just 1 second, so I'm going to lay that aside. I'm going to tell you, I'm going to go through some announcements and while they're giving me some revised numbers. This week, we're only going to have 2 briefings. We're going to go today and Thursday. We'll be back on Monday, Wednesday, and Friday next week. On Friday of this week, we're going to do something that is pretty special, and we're going to give away our last car on, you know, which is a Corvette. We're going to do it at the, I guess, the car show. Is that what it is here? And we're going to do it right here on Friday. And so we got that going on and everything. So we're going to do briefing Monday and Thursday of this week, and we're going to do some nice stuff, you know, with you know, a great show that is in downtown Charleston here and everything. We're so happy that, you know, all the different things that, you know, with the automobiles that we're doing, and so with all that, we'll sign off on our last car giveaway and everything, and Baby Dog will come down, and we'll go through all the people and let you know, the people that enjoy seeing her and everything, and then we'll give the car away, and we'll be encouraging everybody, every single one of those people, to some way, somehow, at least consider getting vaccinated. Let me think if there's anything else that I've got here. You know, I've got this that we're doing a West Virginia law enforcement initiative, and this is a call to all of our law enforcement, you know, officers all across our state. It basically is to receive social and emotional intelligence training. It's called Project EQ. You know, for the most part, all of the folks that have been through the West Virginia State Police Academy received this training, but there's a lot of officers out there that have not received this training, and we think it's just great. And for officers that have received it, if you want to come and repeat, that would be wonderful and everything. You know, several of our state agencies are sponsoring this event, including West Virginia Department of Homeland Security, the Department of Education, Jobs and Hope, and more and more. So It's great stuff. You'll find out more on how to register. Go to the West Virginia Department of Homeland Security website and register, and we're really hopeful to be able to continue to assist and train our officers and the very people that protect and look after us each and every day. So please take advantage. Okay, active cases. We're down to 12,284 active cases now, which it continues to drop, and that's good stuff. We do have 846 new positive cases, but our active cases continue to fall. Our daily positivity rate is up. We probably, it's at 13.57. Our cumulative positive is really close to 6. It's at 5.94. We've got 229,000 people plus that have recovered from this. Our hospitalizations are down to 913. It seems like a lot, but they were peaked at 1,008. Our ICU units is at 271. That's down a little bit. The number on ventilators was at 195. Now it's 184. We do have 3 green counties in West Virginia now, thank goodness. And we have 69 outbreaks in 28 counties on our school kids and 836 confirmed cases. That seems like that's holding there about steady. We've got 54 counties that have the mask mandate. Pocahontas is still not the one that's outstanding there. But again, they have managed themselves very well. They've been in the green most of the time. They're in the yellow now. Still, our hospitalization numbers as far as those that are fully vaccinated that are in our hospitals are about 20% that are fully vaccinated that have this and everything. And so what does that mean? It's all tied to boosters. It's all tied to that. If you really are, that number would be way, 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 way less than 20%, I think, from what I've been told, if we had people running to get the boosters. We're doing that, but we need to do it more and more and more. Reminders, 65 and older, you get any symptom whatsoever, go get a test. The antibodies will save your life. We've got them, we're ready to go. If you go into a crowd of people and you have any compromising situation, diabetes, whatever it may be, absolutely, and you're 60 years old or 50 and older and everything, you probably need to really think really hard indoors about wearing a mask. All the booster approvals are out. We've told you this and everything. It's for Pfizer. It absolutely is 18 and above. Go get your booster shot. If you're 6 months out and you're 18 and above, get that shot. Because we all know the Pfizer, effectiveness drops off. Do you have something else for me, Nathan? Hold tight just 1 second.
Updated vaccine numbers.
Okay. I guess the updated vaccine numbers is, and this is good. This is really good. Now we've given out 1,013,000 with the new numbers where we had, CDC had messed up. We had to back down and everything. But now we're at 1,013,000, which is good. We're at 65% of our population, 12 and above, that have received at least 1 shot, and that's great too. We want to keep pouring it on that. We're at 80.6 of those 50 and older, and 90.7 of those that are 65 and older. So good numbers coming. We just need to keep at it. So again, on the boosters, I tell you over and over, come on now, we led the nation. We led the nation in our vaccinations, and you decided to get vaccinated a long time ago. If you're up for your booster shot, run over top of somebody and get that booster shot, because that effectiveness of Pfizer drops off. We know that and everything. You need that shot. Okay, we're ready to go on Pfizer. Of course, I've told you about where we stood there. I've gone over our numbers. I've told you that tomorrow, I haven't told you this, but Friday we'll give away a beautiful Corvette. We'll do it at the car show. It's a perfect time to give it away and everything. And we'll have a lucky winner that night. Baby Dog will be here. We'll go through the crowd and everything, and all of you, I know, will be happy to see Baby Dog. Probably, you know, maybe there'll be 3 people there that'll be happy to see me, but I know a lot of people will be happy to see baby dog, and I say that in jest and everything, but I mean it. That, you know, she's a face in all this tough stuff, and you may have thought, gosh, how silly that was and everything, but at the end of the day, she's a face that makes us smile. She's a face that absolutely just makes us smile. And with all of that and everything, she also loves everybody. How in the world could it really be better? I mean, really and truly, the little old English bulldog that got to be a big English bulldog, you know, really and truly, how could it be better, you know, for somebody to just be encouraging us, or some companion to just be encouraging us in her way of loving, in her way of making us smile, that God has given us that chance again to absolutely encourage us to get vaccinated. I think it's great stuff. Until tomorrow at midnight, you can register for that Corvette. If you're vaccinated, if you've had 1 shot, you've got tomorrow till midnight to register for that Corvette. Somebody's going to win it. Somebody's going to win it for sure. Register, for crying out loud, and more importantly, go get vaccinated. Go get vaccinated, and that, you know, that will just, it'll just make it better and better. I mean, over this period of time, I've had the opportunity to be in front of lots and lots of kids and encouraging them in every way. I'm sure a bunch of them have gone and gotten vaccinated and everything. And the numbers speak for themselves. Hundreds of thousands since we started these 2 campaigns with Baby Dog, hundreds of thousands of people have been vaccinated. Now, no question, some of them would have been vaccinated anyway, without any question. And some of them are getting vaccinated because we're really pumping this and really working it this way. The bottom line is it's worked. I mean, we don't need to rehash that in any way. There's no way on earth you can look at these numbers and not say super success and everything. And so in that, the whole effort's try to save lives. You know, the vaccine eligibility, 12 and older, I asked our parents and grandparents so many times, help us get the kids vaccinated. It's going to get cold. And when it gets cold, if your kid's not vaccinated, there's a really good chance that they could end up with this terrible virus. May not even know it. They may not even know it. But all the medical team, all of them are telling us that some of those kids will end up with some level of side effect. How can you take a chance? How in the world can you take a chance? Get them vaccinated. Help us to get them vaccinated. Remember, you know, our grand families, you know, remember you've got that $150 voucher. You got 19,000 kids out there in those families. We need them all vaccinated. It'll protect you. It'll help everybody. And you pick up a few bucks and everything, you know, for the school voucher, was, you know, on the grand families. Just help us. All the stuff on the COVID hotline is up there. The free testing, you know about that. Take advantage. We thank Frutz. We thank Walgreens. We've got 73 outbreaks in our long-term care facilities. We have good gosh, it's good stuff, great stuff. We have no outbreaks in our church communities. Way to go. I mean, absolutely fantastic, absolutely just terrific. Okay, we got 234 inmates at 15 facilities that have this, and 58 staff people at 15 facilities as well. I urge you over and over about giving blood. I have said it, arm in arm, we're going to stand by our hospitals. We're going to stand to protect our people, to have access and everything. We're not going to let our hospitals suffer economically and everything. We're going to stand by them and help them absolutely through this really difficult surge and everything, but we're doing it. And the last thing is get a flu shot, everybody. Get a flu shot. You can do it at the same time as the COVID vaccine. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. I think the governor has really given all of us a very complete overview of where we are. Certainly, we know that hospital numbers are still high, although we have seen some positive trends. We also know that people continue to get very ill when they get infected with this variant of COVID-19, particularly those that are not vaccinated. So in addition to getting full vaccination to be eligible for the baby dog lottery prizes and to protect yourself from side effects of long COVID, which can occur into up to 30 to 40% of people who get COVID-19, and also the potential that you could die as the governor reads names every day. Also, please get fully vaccinated so that we reduce the stress on our hospital systems. The heroic workers there are doing amazing work for a very long time, but we don't want to add to stress with them. In addition, it's interesting that the country of Israel now defines with the Pfizer vaccine, full vaccination as having 3 doses. So as we look at the eligibility from the CDC and the FDA, as the governor said, it is really important for people at high risk of developing severe disease. Do go get your booster shot if you're 6 months after your final Pfizer vaccination. And for those who've got Moderna or Johnson & Johnson, approval should be upcoming relatively quickly, as well as emergency use authorization approval, we believe will be coming quickly for Pfizer vaccines for children 5 to 12 years old. Thank you.
Thank you, Dr. Marsh. Next, we'll go to Dr. Ayn Amjad, our State Health Officer.
Good morning. I just wanted to reiterate, and the governor did mention about the importance of flu vaccines. Flu season may be coming up earlier this year, we're not sure, but the flu vaccine is available at most health departments, pharmacies, your doctor's office, and we do want to remind people that you can get the COVID vaccine along with the flu vaccine. Most people likely get it in separate arms to avoid any local site reactions, but it is available in most places right now, so please get your flu vaccine. It is very important, and continue to wash your hands with soap and water or the alcohol gels. It does also help with the flu vaccine as well as COVID-19. Thank you.
Thank you, Dr. Amjad. Secretary Bill Crouch is also joining us today and is available for questions. Retired Major General Jim Hoyer had a prior engagement. He will rejoin us on Wednesday. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question. I've been keeping track of unfortunately, the toll of West Virginians that we've lost since the beginning of the pandemic, and trying to put it into context for people. And today, unfortunately, we have reached a level where the entire city of Lewisburg, West Virginia, which I know, of course, is close to the governor's heart, would be wiped out if the COVID virus was attached to it. Every man, woman, and child, no more Spartans. So the number of West Virginia COVID-19 victims now rank as the state's 40th largest area by population, just to give you an idea. In talking with someone who has chosen not to get the vaccine, I asked them point blank, why not? And try to figure out what's going through their mind. And they said, if you are a member of a class of people who are in danger of getting the vaccine, in other words, if you're old or if you have comorbidities, you should definitely get it. My question is, with this Delta variant, and we're hearing a 20-year-old, a 40-year-old, 43-year-old, et cetera, those succumb to it today, and of course, younger people throughout the past several weeks. Is everybody now vulnerable to this thing, unlike the first wave that came through and then the Alpha variant, that the Delta variant itself makes everyone susceptible to possibly having a bad outcome? And even though statistically it's still very small, now everyone is a part of that net. Could the governor address that, or perhaps one of the medical folks? Thank you.
Kenny, I don't profess to be a doctor, so I'm going to pass to Dr. Marsh, but I think the answer is yes. And I think the vaccine, gives you terrific levels of immunity. If you've had this virus, there is some levels of natural immunity from a standpoint of just what you've picked up from the virus itself. It may be that that's very good. It may be it's not quite as good as the vaccine itself, but I think Dr. Marsh can answer this way better than I.
Thank you, Governor, and thank you, Kenny. Kenny, as you correctly point out, This is a different virus than we've seen before. And although we tend to refer to it as we have to the initial virus from Wuhan, China, as a COVID-19 virus, and the Alpha variant, which was from the United Kingdom, as another different type, different strain of COVID-19 virus, this is perhaps one of the most infectious respiratory viruses that we've ever seen. That was a quote from Dr. Rochelle Walensky, who is the commissioner of the Centers for Disease Control. And this virus is much less selective about who it infects. And we have seen children bear a brunt of these infections across our country. 27% of the new cases of COVID-19 are in pediatric aged people. We have seen about a 254% or more rise in the number of children 0 to 18 that have gotten infected with COVID-19 here. But you're absolutely right. This virus is very highly transmissible, exists in over 1,000 times higher concentration in the airways and in the droplets and the aerosols that are put into the air, which is how COVID spreads. And we know that the vaccines are highly effective in not only preventing transmission, but also in preventing death or hospitalization. In a study from Los Angeles, you were protected 29 times by being fully vaccinated, and a study from Israel 10 times from being fully vaccinated. And as we've talked about with the boosters, particularly for people who have received the Pfizer vaccine 6 months or greater, that people in Israel found that there was a reduction in severe consequences and infection with COVID-19 by 86% as soon as 10 to 13 days after the third booster. So there's no question, the data is remarkably clear, remarkably consistent around the world, that these vaccines are incredibly effective and incredibly safe, and people should take it. And if you're not taking it yet, you know, we look around, as you said, Kenny, and see all the people dying. US just passed 700,000 deaths last week. And around the world, we have seen 4.55 million people die of COVID-19. And we have seen over the last month or so a 9/11 mortality on a daily basis. And we've stopped noticing. So thank you for pointing that out, Kenny. Please get fully vaccinated if you haven't.
Thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I want to ask a couple of questions about our Save Our Care initiative. I know we put that in place around September 20th, so I was hoping to get a little update on how that program is going. Is it having the intended effect? When we put it in place, we said we thought we'd need it for 3 to 6 weeks. Do we have a better idea of the scope of that program and how long we'll need to keep it around? And then at this point, do we have an idea of how much that will cost? How much are we reimbursing? Thank you.
Maybe Secretary Crouch, can you add some color to that, please?
Yes, Governor, thank you. And thank you, Charles. We met with the hospital folks Friday morning. We also have been in discussions this morning about that. We're trying to look at ways to pull down some federal dollars to utilize so we spread our state dollars further. We think we will have the methodology that we're going to use to fund hospitals to help them with their staffing issues within the next day or so, possibly by the end of the day. We're looking at some significant dollars here. The governor's asked us to help and inform the hospitals that we will provide them some assistance, and we're looking in the neighborhood of $25–30 million. We're very hopeful that this will assist the hospitals. They have struggled and had a difficult time in terms of staffing. That problem is a problem that's been all across the country, not just West Virginia. But hiring from staffing agencies is very expensive. Paying overtime is very expensive, and trying to retain staff. So I want to say a thank you to the staff out there in the hospitals that have stuck with their West Virginia employers and have worked through this pandemic to take care of folks. Every day when there are positive cases in the hospital, they go right back into that hospital, and nursing homes as well. Nursing homes having the same problem. So we've provided some assistance to nursing homes, that is ongoing. So that we're meeting the governor's request there in terms of providing assistance. So we hope to have more on this within the next few days. So thank you, Charles.
All right, thank you, Charles. Next to Mark Curtis with the Next Star Media.
Good morning, Governor and cabinet members. I wish General Hoyer was here because he's probably best suited to ask my question or answer it, but maybe Dr. Marsh can weigh in. I'm wondering if we have an update on the supply of monoclonal antibodies. I know we were getting maybe 10% of what the state was promised. Are we out? Where does this stand? Are we promised more this week? I know the Kanawha Charleston Health Department and the CAMC sent out a joint release last week, basically saying they need more and they need them now. So what's the update on monoclonal antibodies?
You know, Dr. Marsh, I'm sure can answer this, but Dr. Amjad, may we can go to her, you know, if you'd like, or you can defer to Clay, whatever.
Sure, Governor, I can. Mark, so we got a supply in that was allotted to us basically by the federal government. We did request more. A lot of states have been requesting more, but granted any more supply. A lot of people are asking for the monoclonal antibodies right now because there is more of a message that's being sent out for it. But unfortunately, we were not given a larger supply that we had requested. But we have sufficient amounts out there for at least some of the appointments that we're getting. The good news is I think that more patients out there who are COVID positive know that it's an option for them to have it. So I think that's why the demand has increased across the state. But for now, we do have enough that we're able to kind of shift it around to the different sites. We've also increased our sites around the state as well. I think that's also why you're hearing more need. So we are continuing to push the administration and the federal resources to ask for more. But I think there is a kind of a demand across the country, which is why we're seeing that kind of input and things that you're hearing out and about. But we'll try to get them to as many people as possible. But it's still not a substitute for vaccines. We want people to realize that as well. Thanks.
And let me just add one thing too. You know, all of our teams working on this and working on the antibodies and everything. I think you know we're just going to continue to work it and everything. The problem is real simple. You had a lot of southern states that rushed the bank, and they sent out an awful lot of stuff, and people really, you know, deferring to just take the antibodies and everything. It's really not the greatest substitute, you know, for the vaccine, but you did that and you had a run on the bank and the supply dropped off. And so I personally have sent a letter to the president myself on Thursday requesting additional supply, and our team's working it really hard and everything. I believe we're on it and we're working it as best we possibly can. And I think more than anything, it's a supply issue.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. I want to ask an elephant in the room question because I've gotten the question. There are a number of healthcare workers that have opted not to get the vaccine. I'd like to know if there has ever been a discussion as to why that is, if it is all personal preference, because these are the folks on the front lines that see the carnage that has developed from this disease. One would think that they would be the first one in line, but there is a pretty big group, I understand, and an even vocal group that says if they're required, they're going to walk out of their jobs. I don't get it, and I'm looking for someone to try to help me understand that. Thank you.
Well, Paul, I think Dr. Marsh can add you know, more accurate information about that than I could add. But Paul, you know, these people are surely no different than all of us and everything. They have views and they have opinions, and we want to be respectful for that and everything. But the reality is just this. They are with an awful lot of folks that do have COVID, and just to tell it like it is, there's a lot of them that decided I'm not going to get vaccinated. And then a lot of them were lying there, you know, in the beds, sick as they could possibly be. I don't know the statistics of how many we lost, but it is just, in my opinion, it's just not wise. I mean, of all people that should be vaccinated, you would surely think it would be 100% of the people that are with the patients every day. But Dr. Marsh, add to that, please.
Well, thank you, Governor, and thank you, Paul. We know, Paul, as the governor said, that everybody that works in healthcare still is an individual in their own right. And we have seen a lot of the miscommunication issues about the vaccines be a cause for concern for some of our younger hospital workers, particularly our younger female hospital workers, that believe the misinformation that was given at the very beginning part of the messenger RNA vaccines, that somehow there'd be some problem with fertility and with having babies or pregnancy. And now it's very clear that all of the oversight groups say that vaccine is not only safe for people with pregnancy, but in fact, every pregnant woman should be vaccinated. Currently, only about a third of pregnant women are fully vaccinated. You know, when we look around the world, Paul, we find that over 100,000 healthcare workers have died from COVID vaccine, largely in places where vaccines are not available. And when we look at our own healthcare enterprise and workers, you know, we want each worker to be safe, and in turn to make it safe for each patient in our healthcare facilities and hospital systems. And that's really the reason why the West Virginia Hospital Association and our hospital leadership decided to require vaccinations for healthcare workers, which was also suggested by President Biden. And I know the governor, while not wanting to centrally mandate anything, definitely wants to make sure that everybody is safe who comes in contact with folks with COVID-19. So we're seeing around the country that many healthcare facilities making these vaccines mandatory, which is increasing the rates. But as the governor said, everybody is still a person that lives their own life and listens to their own sources of information. And we hope that they will see, as we do, that these vaccines are remarkably safe, remarkably effective, and so important to prevent unnecessary illness, long COVID symptoms, or death from COVID-19. Because at this point, with full vaccination and current vaccination, COVID-19 is a preventable cause of death.
All right, thank you, Paul. Governor, I'll turn it back to you.
Okay. First, I'd like to lead off by just saying this. You know, Kenny Bass comes to us a lot of times with a lot of information and everything. He works and he researches, and I love it because, you know, at the end of the day, that's what we all should be doing. And so, you know, I thank Kenny for his insight and I want everybody to really be ever so clear about what I think that he said. But he said that today, with 3,769 total deaths, the 40th largest city in the state, which just so happens to be Lewisburg, according to Kenny, you know, that number of deaths would wipe out the entire city of Lewisburg. Now just think about it. If we saw, you know, if we were in a situation where we just wiped out the 40th biggest city population in our state, the level of catastrophic would be off the chart, would it not? But that's what it is. That's what it is, and we just go on about our business and everything. And if you'll listen to Dr. Marsh, he just said, this disease is one that we can stop. Well, I would highly, highly, highly recommend taking heed to what these people are saying. Dr. Marsh also added that 27% of those that are infected today are from pediatric, or in the pediatric levels. Well, that's very, very young, and we know that. Now, I don't know how we can keep taking these chances. You got a doctor that is your coronavirus czar. He's saying to you, right, just as straight up as he can say, we can prevent this. We can stop this. He's also saying that a bunch of kids are getting this. Now, he also said that all across the world, and I think I'm gonna quote this correctly, that you are 29 times safer if you're vaccinated. The vaccines, he says, are incredibly safe and incredibly effective. We all know that. But you're 29 times safer if you're vaccinated. Now, you got to get vaccinated if you're not. Absolutely. He also said, in regard to our healthcare workers that Paul brought out, we have great questions from all the media. Charles is always dead on, and I'm not going to go through everybody, but it's just good stuff. But Paul pointed out that our healthcare workers, is a percentage of them that aren't vaccinated. And we said, they're people just like all of us. And they have views, and they listen to others and everything, and sometimes they can get scared to death, about opinions or social media or whatever it may be. And social media does a lot for us, but at the same time, it perpetuates things sometimes that are not helpful. But in all of that, Dr. Marsh just got through saying, and I appeal to all of the healthcare community, we've lost 100,000 healthcare workers in this world. 100,000 people that were working with our patients or with their patients all across the world are dead. They're dead. So if you're a healthcare worker, surely, to God above, you got to listen to this stuff. You got to make decisions. We respect those decisions. We respect your freedoms absolutely wholeheartedly, and I stand steadfast on that. But at the end of the day, you're 29 times safer. 27% of the infected are kids. You absolutely have 100,000 healthcare workers that have died. And as Kenny pointed out, we are now at the level that we have lost as many people as the 40th largest city in our state if it were to be wiped out, men, women, and children entirely today. We got to get vaccinated. That's all there is to it. Keep at it. West Virginia, you're really good. You're really good. And I love you with every ounce of my soul. And I mean that sincerely as I possibly can. You're really, really good. And I know that there's some that are stubborn and everything, and we want to love and embrace them in every way. That's their decision. And we're good with it. But every single day we get more. Every single day we get a few more. Now we wish it was a landslide more. But every day we get more. And we're getting through this some way, somehow. God bless each and every one of you. Thank y'all so much.